This building where we're standing, where we're met today, it was opened up when Elvis released Jailhouse Rock, 1957-ish. The place across the way, the Palliser, I think 63, and the Swift Current Care Center is as old as I am. It's 46 years old, and like me, it's showing its age and has infrastructure issues and challenges. It's time for a brand new, state-of-the-art, long-term care facility in this community to serve Swift Current in area. And that's what I'm announcing today. Before I do that, we have some details to announce. I have some thank yous. I want to thank the chair of the Health Region and Beth and her team for their hard work in the Ministry of Health, who have been working on this project. We've advanced planning dollars some time ago now, about $400,000 worth of planning funding and support, and there's been some time that has lapsed between then and now, but not in action. Has not been the case in that intervening time, because the region and the board, the region and the ministry have been working on, continuing to work on the project. So I want to thank them. I also need to thank the frontline staff, long-term, all the staff that are involved in long-term care in this community. They have, for a number of years, been making the best out of these facilities. And in addition to the challenges of trying to provide the best care possible for those who need long-term care, they've had the challenges of facilities that are dated and old, and they've just provided great care. My grandpa just got wonderful care at the end of his life in the Palliser, and everyone has examples of stories of our dedicated long-term care staff in this community, and so I want to thank them both for what they do normally and also what they had to do extraordinarily around these facilities that we have. Ladies and gentlemen, what's going to happen is the region, the health region, is going to issue an expression of interest, a request for an expression of interest from those who can provide long-term care facilities, who've done that in the past in the province, and they will respond. We know that there's already interest. We understand that there will be a response. We're going to take the time to evaluate those proposals and make a decision in the fall. After that, the region and the ministry together with the successful proponent are going to get to work on the specific design. We're going to make sure we're listening to frontline staff in the design. We're going to make sure we're listening to residents and the families of residents in the design. And we're going to do something else. We're going to apply what we call lean techniques, lean design techniques to the facility itself. I'm personally very excited about the benefits of lean in the healthcare system, lean management techniques as well as designs for facilities. We hope that our partners, our other partners at the municipal and school district level will have a look at some of what's happening in government because of, again, our professional public service that are leading in this regard. I can tell you this, that in the case of the Children's Hospital in Saskatoon, millions, literally millions of dollars are being saved in the design of that new hospital. All in the name of not just efficiency, but actually better care, freeing up frontline staff to do what it is they want to do. And Lean obviously leans heavily on their input. We're finding the same thing with the Moose Jaw Hospital. We've announced a new replacement hospital for that community, and the original costs are actually coming down. And we haven't been in government that long, but I can tell you that experience has not been a regular phenomenon in government where costs come down from an original estimate. So we're going to use use what we've learned in that area and rely on our professional public servants and the healthcare providers to bring the benefits of lean to a brand new long-term care facility in this community. It's likely, though we don't know the exact number of beds, it's likely to be more beds than we have currently. I think we're at about 195 or so when you look at the 3 different facilities. There's in the original design, I think we were looking at about 220 plus or so in the new one, and so we don't have a specific number yet. We're not going to preclude the design process or prejudge the design process, but we're likely going to be, having more long-term care beds than we did previously. And so after all of that work's done, again, we hope to be at an opening here in the ground in 2013, hopefully in the middle of the year. Although again, we want to give some time for the design, for the lean process to take effect, and sometimes that does take a little bit longer, and it's worth the wait. So we're grateful for our partners at the municipal level. I want to thank the mayor and the council and the administration at the city for their leadership in this regard. You will know that some time ago, prior to the last election, we committed to improve the funding model for municipalities by decreasing the amount that needs to come from the local community to 20% from 35%. There will still be that requirement in this model, even though the government itself is not building the unit, the facility. But we're going to work carefully with the city so that's managed and certainly affordable and appropriate for the community and for the citizens of Swift Current. But I want to thank the municipality for their leadership, the city for their leadership in this regard. We appreciate that. We also want to say that we're going to not prejudge the process. The expression of interest will come in from folks who will look at design and operate potentially, or just to build and design. But either way, we know we are going to need our long-term care professionals that we have in this community, continuing to provide that long-term care and helping us make sure we get this facility right. So I just want to say to all the folks who've come, thanks for coming on relatively short notice. We have all the approvals necessary, and so today seemed like a good day to bring everyone together for some good news. It's been said by many that the best way to judge a society, or one of the best ways to judge a society, is how we take care of those who are most vulnerable among us. You know, truthfully, I think we look back on the last few years as our staff have tried to make the best of these facilities, and I think we all knew we can do better for those who are most vulnerable in this area, and we are going to do better with a brand new facility and give those residents, those long-term care residents, patients, and our staff a state-of-the-art, outstanding facility that we can all be very, very proud of. So, do you guys want to ask some questions right now? I can try my best to answer them, or?